Hello and welcome to Health Professional Radio. I'm your host, Neal Howard, for this Health Supplier Segment. Thank you so much for joining the program today. Our guest in studio is Mr. Jim Mahon. He's Managing Director of Compass Clinical, and he's here with us to discuss how a growing number of hospital and health system CEOs are turning to interim healthcare executive talent to help fill some temporary vacancies in leadership, achieve significant change in a department, or perhaps mentor in-house managers. Welcome to the program, Jim.
Thank you, Neal. It's my pleasure to be here.
Thank you. You're the Managing Director of Compass Clinical. Talk about Compass Clinical. What exactly is Compass involved in?
Well, Neal, Compass is one of the leading and also smaller consulting groups in the country. It's been around for about 40 years. Mm-hmm. And its significant amount of its activity involved helping hospitals when they get in trouble with either the federal government or with the regional accrediting agencies when they've had a major incident, which puts them in the term they use as immediate jeopardy. So we will assemble sort of almost a SWAT team of doctors and nurses to go into hospitals and help get them out of the situation they're in sometimes that needs like an immediate response. And the other major thing we do, we place interim executives in hospitals around the country when they need a seasoned veteran to come in because they've had an immediate need for leadership, either through sometimes, sadly, a sudden death or a termination or somebody leaving with limited notice. And they've got to get somebody in there quickly who can hit the ground and be effective, not just sort of hold the place.
So you've got a staff of executives that can go anywhere basically at a moment's notice to fill in until a hospital or a healthcare organization finds the perfect fit. Are there ever instances when your interim healthcare executive is the perfect fit and they go with an organization, or is that something that normally doesn't happen?
Well, that's a great question. I would say in about 80% of the instances when we send in an interim, at some point they're offered the full-time job. Now, most of the time they respectively decline because they want to remain probably in the city or state where they're residing with their family. But oftentimes they are offered the job, and rarely, but sometimes they will accept it, and that's fine with us. If it's a fit, it's a great thing. Most of our interim executives, we use the term we're grizzled, not chiseled. Most of our executives are very seasoned, have been in the C-suite and health systems across the country, so that any position they go into, they've been at least at that level, if not one or two notches ahead. So they can come right in and start working immediately on correcting what issues there are, whatever charge that the employing hospital wants them to fill. And consequently, a lot of them will work 6 to 9 months, and then they'll want to go back and spend time with their grandkids or travel. So they're used to high intensity, 60-hour weeks, and then they go back home every other weekend, and then they come back, and it's a very it's a special kind of person that can do that.
Now, this requires some extensive travel. You're talking about going back home. How does this extensive travel affect the quality of care?
Well, what we do as part of the arrangement is that we actually fund their travel home at least 2 times a month. And it's pretty quick. It's usually they'll leave after the end of the day on a Friday, and they're back on Sunday evening. Sometimes they'll stay over and work the weekends, maybe 2 of the 4 weekends. It just depends on the arrangement. And a lot of the work they do, besides being actively involved on the floor, they can do electronically as well. So it works out that most of our clients are more than happy with the amount of effort and time that our folks put in.
Now, have you ever operated as an interim executive yourself? I mean, you've got well over 30 years experience in operational improvements of healthcare facilities.
Yes, I have. In fact, I just came off an assignment that was supposed to be 6 months at the University of Texas Medical Branch in Galveston, and it went almost 4 years. And this is not unusual. A lot of times our folks will go in, and in my case, I had 6 different assignments. I went in initially to oversee the running of the research program, and then I did that for a couple of years, and they asked me to do this and that. And so it could be very fluid, but if you love the place where you're working and the team you work with, Compass is happy to make the arrangement for you to stay longer until they finally get to the point where they do want to get a permanent person in there. And most places eventually want a full-time person that resides there and is part of the community.
Well, let's talk about, I guess, some of the boundaries that maybe have to be set by the interim healthcare executive going in, and maybe some of the boundaries that the facility might expect. I guess, what do you have a right to expect when an interim comes in?
Well, that's a great question, Neal. I think one of the reasons that the interims are becoming even more attractive to health systems these days is that a good interim can come in and immediately do an assessment of what needs to be done at the institution. Spend the first 2 or 3 weeks on the job, but also creating a full assessment report of all the things that current status and recommendations for immediate implementation. At the same time, they can assess the current staff and see if there's anyone on that staff that is workable and coachable up to take the permanent position. So they can do a full staff assessment. And if they feel that there's no one there capable of filling the job on a permanent basis, they can help in the search. So you get all of that kind of activity. And then what you also get from a good interim is you get them making the tough decisions, sometimes regarding personnel hiring and firing, that they take that on and can sort of be the heavy person. So when a new person comes in, they don't have to expend their political capital in making some tough decisions. They can come in with sort of a clean slate and move forward without having to make personnel changes.
Now, you did mention making the tough decisions as far as hiring and firing, I guess, as evaluating the staff to see if someone present is capable of taking over the position that they're acting as interim, in addition to weeding out staff that may be causing problems or causing less than effective care?
Yeah, sometimes, you have these, executives of hospitals have been there a long time and they've got great relationships, and sometimes maybe they're a little blind to the fact that because of friendships and relationships that maybe this person needs to be maybe moved into another role or counseled or given a coach, or just needs some sort of corrective kind of action plans, either to try to make it so that they can stay, or at some point, maybe if that doesn't work, to say, look, you've got to cancel this person out. And sometimes our folks actually will do that if it really becomes very difficult for the permanent executive at the health system to do that.
Do your interim executives offer education in addition to evaluating staff and basically taking over the reins until that perfect fit can be found? As far as, maybe classes, do they offer the counseling or the coaching?
They will do a fair amount of that on a one-on-one basis. When they go in, they know that mentoring and coaching is part of their role. And especially, there's a lot of pressure because when you come into a situation like that, a lot of times you're coming in, there's a lot of stress. There's been some dysfunction going on. So you are looked at as a person sometimes sort of suspiciously, or as like, maybe the heavies upstairs from the C-suite brought you in. And so you really have a lot of pressure on you to show that you are a colleague, that you're supportive of all of the department folks that you're responsible for, and you're not in there to clean house. So a lot of what you really are doing, to your question, is you're mentoring, you're coaching, you're at least, if you're not teaching the courses, you're helping the staff develop sort of an educational program where they either can get in-house help or you can send them to various conferences and seminars.
Let's say I'm a CEO of a hospital or a healthcare facility. What should I focus on? Where should my interests lie when I'm considering bringing Compass Clinical on board?
Well, overall, if you're at the point where you're looking at getting an interim or you know that there's some shortcomings within the organization, the best thing to do is have Compass come in not only with an intern, but 2 or 3 other folks, usually a physician, a nurse executive, and an operations person, and sort of do a 1-week intense 5-day assessment of the entire organization. Okay. And we're pretty good at that because all these folks are seasoned. And that way, you come out with like 15 or 20 finite recommendations after about 5 days. And then from there, you have a roadmap. Maybe you don't need an interim. Maybe you should look at this person as somebody that needs more coaching, or this person needs to go. You get a whole bunch of different options, but it gives the CEO a real blueprint for our best thinking.
And as far as those stakeholders in the facility, are you ever in contact with them, or is it strictly on-site, hands-on, and the stakeholders pretty much get their information at the annual or quarterly meeting?
Well, in some cases, the board will actually ask us to come and bring in an interim CEO. So in that case, you're working with more stakeholders. But generally, most of the folks that we staff are at the vice president and director level.
Okay.
And but occasionally we put in there some outstanding. We've got several former presidents of academic medical centers and CEOs that are on our bench and love to come in and do 6 months of work like that. And they're outstanding. We just had one go to China to do some work. So we've got a pretty fluid group of folks that can respond pretty quickly, because a lot of them are semi-retired at the higher levels, at the CEO level, and they're great to come in.
And where can our listeners get more information about Compass?
Well, you can go to basically our website, the best place to go, compassclinical.com, and they're certainly free to call me at area code 513-675-0150. It's my cell. Happy to chat with anyone that might have some questions.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, on this Health Supplier segment, in studio with Mr. Jim Mahon, Managing Director of Compass Clinical, here in studio discussing how a growing number of hospital and health system CEOs are consistently turning to interim healthcare executive talent in order to fill some temporary positions in leadership, achieve significant change in a department, or mentor in-house managers. It's been great having you here with us today, Jim.
Thank you, Neal. I appreciate the opportunity to chat.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.